Pnawn da a croeso. Good afternoon and welcome to the Public Health Network Cymru's webinar series. My name is Zoe Wallace and I'm the Director of Primary Care and the Programme Director for the Primary Care Hub at Public Health Wales. I'm delighted to have the opportunity today to chair the Greener Primary Care Framework and Award Scheme launch and to share with you the culmination of a programme of work that started back in 2019 pre-pandemic. Over the next 60 minutes, you'll be hearing about why the scheme is important from a national policy and professional perspective, details of the scheme itself, reflections from some of our pilot sites, and most importantly, if you're an independent contractor, how you can join up today. A couple of housekeeping points before we start. After the presentations, there will be a chance for you to ask questions. Please use the chat box at the top of the screen to type in your questions throughout the webinar. If we run out of time to answer your questions today, we will provide a written response post-event. The webinar is being recorded and will be made available on the Public Health Network Cymru's website after the session, and both English and Welsh subtitles are available. These can be switched on by using the buttons at the bottom right-hand side of your screens. However, we are aware that the Welsh audio generated subtitles are sometimes inaccurate. If you experience any difficulties with the technology today, please let us know through the chat box and the team will contact you directly. So, without any further delay, I'm delighted to introduce our first speaker, Natalie Proctor. Natalie is the Head of Pharmacy and Prescribing Branch in Welsh Government, with an interest and taking a lead on environmental sustainability, particularly work around medicines and especially inhalers. So Natalie, over to you.
Thank you, Zoe. Okay, pnawn da. Thank you. Good afternoon, everybody. My name's Natalie Proctor. So as Zoe said, I'm the head of the Pharmacy and Prescribing Branch in the Welsh Government, and I'm the Primary Care Decarbonisation Policy Lead. So it's fantastic to be here this afternoon to celebrate the launch of the Greener Primary Care Framework. I know the team have planned a really informative session for you today, and I'm so grateful to everybody involved for all of their efforts in this vital piece of work. And that gratitude extends to each and every one of you as well. Just by being here, you are positively advocating for a greener, fairer Wales. So I'd like to take a few minutes to share an introductory video, which has been designed by the climate change team in the Welsh Government to help set the context for today and to get you thinking about the role of health and social care in climate change and how we as clinicians, but also people of Wales, can get involved. So if the technical team could just play the animation.
Our climate is changing, and extreme weather is now more likely in Wales. These changes can make it harder for us to deliver essential health and social care services, can harm our health and well-being, and increase inequalities, putting vulnerable people at risk. Wales was the first country in the world to announce a climate emergency, and our health and social care system is on the front line to combat the impact of climate change, and will need to strengthen planning to respond to those expected impacts. The NHS and social care sector in Wales are also contributing to the problem, producing over 1 million tonnes of CO2 equivalent a year, the most within the public sector. We need to work together and act now to create a fairer, greener Wales and protect the health and well-being of future generations. Under the Wellbeing of Future Generations Act 2015, public bodies in Wales have to think about how the climate will affect our future health and how we can protect our health and social care systems. Wales has set a legally binding target to become net zero of emissions by 2050, with the ambition set out in Net Zero Wales for the public sector to be collectively net zero by 2030. Organisations in the public sector need to work together to measure the emissions they produce in order to reduce them in key areas. The NHS Wales Decarbonisation Strategic Delivery Plan sets out how NHS Wales will start to collectively reduce emissions by at least 34% by 2030. Our plans for this include transitioning vehicle fleets to more sustainable energy sources like battery electric, using low-carbon heating in all buildings, and transitioning all lighting across the NHS Wales estate to LED. Requiring NHS suppliers to reduce their carbon emissions. Reducing the use of environmentally harmful medical gases and encouraging more sustainable inhalers. Designing the health and social care system to be as low carbon and effective as possible. A route map for social care and additional support to primary care will help these providers to reduce emissions and collectively reach the Net Zero Wales ambition. We can all help. If you work for the NHS or in social care, why not ask your organisation what they're doing to reduce their carbon footprint and how you can get involved? Join your local green group or attend carbon literacy training. Most importantly, think about how you can use less energy, prescribe more sustainably, and of course, reuse or recycle more at work and at home. If you're a member of the public, you can help by returning unused medicines to pharmacies, asking your doctor for a more sustainable inhaler, or using active or public transport to attend your appointments. Click share on this video to spread the word and search Working Together to Reach Net Zero All Wales Plan to join in with others who have pledged to take action and to help the health and social care sector ensure a fairer, greener Wales.
Thank you. Now, today really is about working together to reach net zero. As clinicians, you're trusted members of society, and you can make both professional and personal decisions that protect our patients, but also our planet. And the Greener Primary Care Framework is an excellent way of supporting these sustainable decisions. It's also an excellent example of collaborative working, with government policy leads coming together with Public Health Wales, professional bodies, contractor bodies, and our frontline workers. I'd like to think this has helped to develop a series of actions within the framework that are going to make a real difference for the people of Wales, but are also achievable for you as clinicians. On that note, I'd like to personally thank all of our clinicians and their teams across primary care who have thrown themselves into the pilot so enthusiastically, and it's really helped to provide some real-world feedback for today's session. So more information about the framework is going to be shared throughout the course of the afternoon. I'd also urge you to visit the Public Health website, where you can hear more from both of our Climate Change Minister, Julie James, and the Minister for Health and Social Services, Eluned Morgan. So there'll be some links shared throughout the course of today, where you can visit the Primary Care One website to see these video clips from our ministers. Lastly, I'd just like to ask you all to share your experiences today with other like-minded colleagues so we can all make a difference. It's important to remember that taking action against climate change isn't about doing everything perfectly. It's about everyone making small-scale changes and contributing in whatever way they can, whether that's at a policy level, a professional level, or a personal level. So diolch yn fawr, and thank you. Enjoy the rest of the session today. Back to you, Zoe.
Thank you, Natalie, and thank you for outlining the context of the climate change emergency that we're looking to address now, and for recognising both personal and professional contributions individuals and organisations can make towards net zero. The link for the Primary Care One website has been put up in the chat bar and will be coming out with information after this event today. And as Natalie said, you can see the personal message from the Minister and the Deputy Minister. And we will also be uploading a message that the Future Generations Commissioner has wanted to send out to contractors. She likewise is a full advocate for the Greener Primary Care Framework and Award Scheme. I'm now going to hand over to Sian Evans and Angharad Wooldridge, who are colleagues in the Primary Care Division. They're going to talk you through the development of the framework and the award scheme, from the concept through to how we've got to where we are now, and to introduce the scheme itself. So Sian, over to you.
Thank you, Zoe. So hello, everybody. My name is Sian Evans. As Zoe said, I work in the Primary Care Hub in Public Health Wales. I'm a consultant in public health, and we're going to just run through a couple of slides today to give you some high-level information, because a lot of the detail will be provided by some of our guest speakers later on in the webinar. So firstly, next slide, please. Firstly, I just wanted to set out the stall about what the primary care framework is, and it's a framework for all 4 primary care contractors in Wales. What that means is general practice, community pharmacy, community optometry and community dental. And within the framework, there's a series of actions. Some of them are actions that could apply to any setting, and there's about 30 of those, and they're quite generic, usually non-clinical actions. And then there's about 4 or 5 what we've called setting-specific actions, and they've purposely been included. For example, Natalie mentioned inhalers in the video. So the inhaler issues are very pertinent to general practice and community pharmacy, but probably of less relevance to optometry. So we've chosen actions that settings can work on that are related to the work that they're doing. Some of the actions are clinical, some of them are non-clinical. And I'll run through a couple of those in a moment. And what we've done is, in including the actions, they've aligned to a lot of the policy drivers in Wales. So we talked about the Wellbeing and Future Generations Commissioner. It aligns to that work, the decarbonisation plan and a number of other policies. The framework is online, and we'll have a demo from that later on in the webinar from SOS, which we're very grateful for, and it'll be managed by SOS, who will talk you through the awards process. And a big thank you. You'll hear about the pilots here, but over the beginning of the year, we worked with 12 pilot practices, and that was really invaluable because that's helped us make changes and shape what you're being shared today. So we're very grateful for them, and we're very grateful for their input into the webinar today. Next slide, please. So I talked about a couple of the actions, about the actions that are included. So these are just picking out a couple of them. The top 3 are what we're calling the non-clinical actions. They are the generic actions that apply to any settings. So whether it's be looking at existing lighting and making changes to more energy efficient options, whether it's working as a team and having greener issues on the agenda as your practice team, or whether it's looking at what you buy in with regard to stationery or other products and how you use those products. And then the final action here is one that sits within the general practice specific section, and that's all about inhalers. There's a lot of work going on across Wales around inhalers. There's a lot of work going on across Wales and a number of the actions within the toolkit and the framework. And what you'll see is that it's the same narrative being repeated. What we've tried to do within the framework is pick out the quick wins, pick out the hot spots, and also provide information to help practices get going with making some of those changes. I'm going to hand you over to Angharad now, who will talk to you about how we find ourselves here today, and then talk about the call of action we'll be asking from everybody on the call, be it a contractor or an organisation that might be able to share the word. So thank you.
Thanks, Sian. Can we have the next slide, please? Fab, thank you. So I'm just going to quickly explain how we find ourselves at the national launch today. So this scheme has been in the making since pre-COVID, when a need was identified for a Once for Wales resource to support primary care contractors to be more green. Unfortunately, just as the scoping work began, COVID hit and the work was paused. During 2021, however, the Welsh Government published the NHS Wales Decarbonisation Strategic Delivery Plan, and this gave us a great hook to align our work to once we restarted last summer. Since then, we've spoken to a number of stakeholders to find out what they wanted from the scheme. We've developed multiple iterations of the framework and have tested it via the pilot. So today is the culmination of all of that hard work within the Primary Care Hub. Next slide, please. However, we know that there's a long way to go if we are to decarbonise the public sector in Wales by 2030 and the private sector by 2050, and we are but one cog in the bigger machine. So looking ahead in the medium term, following our national launch this week, we will continue to raise awareness and promote the scheme amongst the contractors and aim to get as many practices signed up and taking action as possible. Every year the scheme will undergo a new cycle to ensure the actions remain appropriate and relevant. This year, the framework will be open for evidence submissions until the 28th of October, and informal audits will take place with practices on the 16th of November. Following this, we will award those practices who achieved the required number of points and then work with the expert group to review and improve upon the framework before it reopens in early 2023. Next slide, please. Okay, so before our section of the webinar ends, I just want to emphasise our key take-home messages, some of which have been suggested by our pilot practices who have already started on the framework and accumulated quite a number of actions and points. So number one, if you work for a GP practice, a community pharmacy, an optician's or a dental practice, please sign up now for free. We'll keep posting the link to the framework in the chat bar during the webinar. Number two, get the whole team involved. This isn't just something for the clinician or the manager of your practice to take on. It works best when you have a mix of staff taking part, as everyone brings their own suggestions to the table and knows a particular area of the business best. Our pilot sites have reiterated several times that the scheme is a real equaliser amongst teams. Number three, after signing up, make sure you take some time to read all of the actions within the framework. You might find that you've already considered or started some of the actions, and in which case you'll have a slight head start. Finally, don't feel like you need to complete every single action straight away. Start small by choosing 1 or 2 actions, see how you get on, and let the momentum build gradually. And a great quote that I discovered recently, which I hope will inspire and reassure you, is, "We don't need a handful of people doing zero waste perfectly. We need millions of people doing it imperfectly." Next slide, please. So I'll leave you with these quotes that to me sum up our ethos and which I hope will resonate with you too. That's it from me. Thank you very much. And back to Zoe as chair now, please.
Thank you, Sian and Angharad. It certainly has been a journey since 2019, and we have built a firm foundation with our pilot sites and our partners for us to move forward on now. And on that note, I'm going to hand over to Celine Clark. She's a project manager with SOS-UK, our charity partner in this scheme. Celine is going to do a very quick demonstration on the tool itself to give you a visual orientation of what the tool looks like. Thanks, Celine.
Thanks very much, lovely to meet you all. So I'm just going to go for a few slides first to let you know what the Green Impact Scheme is and how it works, and I'll do a bit of a framework demonstration so you can see how it looks in real life. So if you can go to the next slide, please. You can go to the next one after this. Thank you very much. So yeah, I'm Celine Clark. So I work for SOS-UK, which is an educational charity focused on sustainability. Green Impact is one of our biggest programmes. We've been running it for about 15 years, so we're very happy to have Public Health Wales working with us on this programme. It's designed to support environmentally and socially sustainable practice within organisations. And we really believe that as a staff who work in a place, you are the best place to know what needs to change on the ground in terms of teams, departments, practices. So really want to see the staff-driven change happen across Wales as well. A Green Impact gives you the tools and support to tackle these sustainability issues within your team and wider practice. So the way it works is that you log in to access an online framework, which I'll go through quite soon. And these have various sustainability criteria that you can choose from. There's no sort of set pattern. You can really choose what you're interested in. So for example, if you're more interested in energy, biodiversity, waste, carbon management, you can sort of pick and choose the actions that are most relevant to your practice. Every single criteria that you do will earn you a point. And at the end of the year, depending how many actions you've completed, you'll get an award. So that's essentially a very brief summary of how Green Impact works. And if we go to the next slide. So as Sian mentioned, the framework is divided into 4 areas of primary care. So you've got community pharmacy, primary care dentists, general practice, and community optometry. So for most of you, I imagine you'll probably fit into one of these areas, depending which of those areas you work in. And as mentioned earlier, each tab has around 30 general criteria that can be completed by anyone, as well as 4 to 5 bespoke criteria that are more specific to that area of practice. So for example, a GP practice would use a general practice tab, would probably complete some of the general actions, but also look at those specific actions that are specifically for GPs. Likewise, if you're an optometrist, dentist, or pharmacist, obviously you'll have the specific actions that relate to your area as well. So choose a tab that's most relevant to you and complete actions from this throughout the year. There's also a special tab, which is at the bottom, which we'll mention more towards the end of the year. This is just a nice place where you can recognise, and by nominating a colleague or your team for some extra awards, to really recognise that extra hard work that you've put in throughout the year. So that's just a nice extra thing you can do. And next slide, please. So the awards, as I mentioned, each criteria that you complete is worth 1 point. So nice and simple, hopefully no confusion there. Every single one of these obviously will count towards an award. So depending how many things you complete throughout the year, you'll get an award at the end of the year. So working towards award, it just recognises that you've started. So if you complete even one action, that's the working towards. Bronze is for completing 8 criteria, which is worth 8 points. So definitely quite achievable. If you're worried about October not being too far away, I think bronze is definitely very achievable for almost every single practice. Silver is completing 17 criteria, so 17 points. And then gold is completed 24 criteria, so 24 points. So obviously, you're not expected to complete every single thing. You might just want to start off with bronze, see how you do. Perhaps next year you could work to silver or gold. Or if you are feeling really ambitious as a team and have lots of capacity, obviously feel free to go for gold as well. Entirely up to you and your team. Next slide, please. So just an example of how the actions look. I will do a demonstration in a moment. So each criteria will have various sections. So if you can see on the screen there's a little screenshot which has the criteria there, and you can see further information, how you'll be audited, and comments and evidence. There's 4 buttons across the top. So each of those areas tell you something about the action. They'll tell you, for example, more information in terms of further resource links, what the auditors will be looking for. And it will also show you some sort of area where you can add comments and evidence. So for example, if you'd like to put a comment to say our team did this action XYZ way, here is some extra evidence, you can upload things throughout the year. You don't have to upload evidence for absolutely everything. It's very much up to you. It is something that's voluntary. So if you want to upload some screenshots, minutes, photographs, social media posts, etc., it's very lovely for us to see those things throughout the year to see what you're doing. And it also shows the student auditors what you've been doing sort of in a visual way. But obviously don't worry if you don't have much time, you could just sort of keep it quite brief with comments if you wish to. And then the final slide from me. So I will in a moment screen share this fully. So in terms of registering, there is a page here which you can register. The link has been put in the chat a few times now, so hopefully that will encourage you to click on this after this meeting and have a look at how to register. The code is 44247. So this is the same for anyone new. So obviously if you want your colleagues to join, anyone else from your practice, please do share that code with them as well. You can create your own account with your own name and password and email. And then you can choose English or Welsh as the preferred language. So the toolkit, the whole framework now is available in both English and Welsh, so obviously whichever one is best for you. If you are the first person joining from your team, then please create a new team. And then once that team is registered, your colleagues can then choose to join it by looking at the drop-down list of team names, which I'll show in a moment. And final bit from the slides is the submission deadline is 28th of October, followed by the 16th of November audits. So you've got a bit of a calendar idea of how much time you have for this year's programme. So thanks very much for listening to me for the slides. What I'll do now is I'll briefly share the actual framework so you can see how it looks. So hopefully that's visible for everyone. Please let me know if not. So this is the intro page. There's lots of useful information here. I do definitely recommend having a bit of a read through. If you scroll down, it will tell you how to register step by step. So again, if you have any issues, do have a look at this intro page or lots of information there. To register, it's the button on the right hand side here, which is register. It will take you through a registration form where you add your first name, last name, email, and so on. And as I said, if you are creating a new team, please add a new team name. So ideally something like your practice. So you want to put, for example, so-and-so GP practice. And that means that your colleagues can join it by looking at it on this little drop-down list. So you can see lots of practices have already signed up. If you are joining a practice that already has a team, then you should be able to find them on this list here. Obviously, ask your colleague for the team name if you're not sure. So that's the registration. I will now head back to here and log in with my example password to show you how it looks as a user. So again, some slightly different information now on this first page. You can see the dates and so on. Do familiarise yourself. The About page and the Help page here at the top have lots of really useful FAQs and information. And if you want to have the framework in Welsh, just click the little Welsh flag here and you will now have it in Welsh displayed. So just to show you how the tabs look, if I was, for example, a dentist practice, I would be working on the primary care dentist tab, just here on the left-hand side. Obviously, if you're working on any other areas, please click that tab. So now that I've registered, I can click to that tab and it will take me to the actions that are relevant to dentistry. So as Sian mentioned, there's lots of actions that are more general here. You can see different categories like buildings, healthy behaviours, procurement. It is really up to you what you want to do. And at the end, there's a few primary care dental specific that are specific to dentistry. So you can choose to do some of those, as it works exactly the same for all the other tabs. So in terms of how the actions look, if I click show all on the buildings and estates part, you'll see the little actions actually pop up now. So you can see they've been mapped to the SDGs. So this one links to SDG number 7 and 13. So you can see what it links to. And the action is all about replacing existing lighting with more energy efficient options. So again, a very sort of building centric one. The further information tab will give you extra links, extra resources. So please do read through that, especially if it's a more tricky action. This is the part of the criteria that will really tell you how to actually go about completing it. You've also got the how you be audited section, which tells you what the auditors will be looking for. So if you're not quite sure what to upload, what sort of comments to add, have a look at this. And finally is the comments evidence section. So here, as a team, you can all add comments. You can type in this box and basically let the auditors know how you've completed this action. It can be a few sentences, it can be sentences. As I said, you don't have to write an essay, you don't have to upload lots. It's really up to you how much you want to add, but it is really useful for the auditors to know how you completed an action. So I suggest perhaps adding a sentence or two is an ideal amount. And you can also upload some extra evidence if you wish to. So things like photographs, screenshots, emails, and so on. As I said, obviously up to you. Please don't add anything confidential, is that what we ask. So if you add, for example, emails, just make sure you've not got any patient information or anything there as well. But essentially all is here. If you ever have any issues with anything on this side in terms of logistics, uploading things, please do drop me an email and I can help you out. Once you complete an action, you click done. So you can see the little green bar here. So if I click done, it will then ask me if I'm doing this as a result of green impact. You'll get the points either way, so don't worry about which answer you choose. Essentially, this just tells us, is this something that your practice is already doing, or is it something you're doing because of taking part in the green impact scheme? So please click whichever obviously applies. If I was to click that this is something brand new, I'd click yes. And then as you can see at the top, it now says completed 1 out of 34, total points 1 out of 34. So now you can see you've got 1 point towards that, for example, hitting bronze, which is 8. So not too difficult. You can go through and add those points as you go along. As Angharad mentioned, you probably have quite a few quick wins. So do have a look for these actions, familiarise yourself. And you'll probably realise there's quite a few things that you might already be doing as a practice already. So do have a look through those at the moment. Whenever you add anything, add any comments or add any evidence, please make sure you save changes regularly. So the save change button is up here. Make sure you save changes and then it will tell you successfully saved. So that means all your work is saved, because if you stay logged in for too long, it might log you out. So please do click save changes regularly. I will emphasize that again. But yeah, thank you so much for listening to me. Hopefully you'll all enjoy using the scheme. And if you need to contact us, everything is on the contact page. You've got the Green and Primary Care Wales email, which is more for general questions about the healthcare side of things in terms of how to complete certain actions or further resources. If it's an issue with the actual framework or any tech issues, please contact me. My email is here. So I'll hand back to Zoe now. Thanks very much.
Thanks, Celine. I hope that's provided you all with a quick visual idea of the tool itself and the navigation of the website. I know there's been a couple of questions that we will pick up in our Q&A session later on, so we've got those recorded to reply to you, and we'll also send out, as I said, a written response to all of the questions today. So I'm really pleased now to introduce 4 of our contractor partners who participated in the Greener Primary Care pilot sites, voluntarily giving up their time to test and pilot the framework. They will now share their experiences with us. So Tim, Juliet, Louise and Sian, who will present on Andy Evans' behalf from JDS Pharmacy in Newport, who is unable to join us today. So I'm going to hand over straight away to the team and they'll talk you through their experiences. Thank you.
Thanks, Zoe. Thank you. And hello, everybody. I'm Juliet. I'm the practice manager at Llanfyllin Medical Practice. We're up in the furthest point of North Powys, a very rural practice and large dispensing practice covering about 600 square miles. So we were really interested when the opportunity came to put forward as a pilot site to participate and see what we could do, because we were very conscious of our team's travel and the delivery times and patients travelling to practices and all the other things that happen as part of our working day. So we were very happy to be accepted as a pilot site, and I think initially very daunted actually to be taking part and to think that would be other things that would be coming into our day when we already felt under a lot of pressure and very busy dealing with the demands of COVID and the normal workload of general practice, which, as everybody knows, has sort of escalated along with other areas in primary care. So it's actually very refreshing to take a look at the framework initially and be able to see that there were some areas, as Celine's just alluded to, where we could make some very good quick wins that made us feel that we would got our sort of a few rungs up the ladder already fairly quickly without it being too onerous and putting lots of work in as a practice. And it sort of helped get the team on board as well. So we very quickly got engagement from the rest of the practice team as something that we could all look at that we found really mattered to a lot of the members of our team. And particularly after a couple of years of dealing with the really acute sort of firefighting work in practice, it was really nice to be talking about something else. Something that mattered, greatly to a lot of our team and to our patients, and to be able to sit down as a team and discuss the things that we could start doing fairly easily, that people could all get involved in. And we got really good buy-in from the rest of our practice, and people seem really open to being able to kind of look at little areas that they could take on board themselves, that we could work towards as a practice. We achieved 20 of our 34, I think, sort of areas that we were looking to work on, having picked 5 areas that we wanted to look at as a practice. So they included the carbon footprint for the practice, which we had support from Dr. Ellie Massam in completing for the practice, and that's been really useful for us to have a benchmark of where we start from. We also looked at healthy behaviours and well-being of our staff, which was obviously massive anyway, because we want to look after the team that we work with, but also particularly after 2 years of relentless workload, to be able to look at things that we could do as a practice to support our team and to create a better working environment. So that was really important to us, and we've really enjoyed doing that, and that's gone down really well with the rest of the team. And we looked at the inhaler project, which we're working through, and our pharmacist is leading on that, so that's been really good, and we're sharing that out to the rest of our colleagues within Powys, and we'll be looking to do so within Cluster. And we've shared with the LHB the work that we've done so far on that to help support other people with their little journey. Sort of conscious of time, but just wanted to say, really, I've seen a few comments in the box about could we look at the framework before sort of deciding whether to undertake. I would really sort of advocate anybody, if they feel they can, just signing up and having a go at this. You're really not committing yourself to anything too onerous. There are some bigger aspects of the framework that we're going to start working towards, but really there are some things that you can do very simply without any great cost or any great loss of time within your team, to being able to get yourself some rungs up that ladder, and to the feel good factor. I think I can't express enough that we've all experienced, myself as a manager and the rest of the team, in participating in this pilot, and then the ongoing work to continue delivering on this has just been such a benefit to all of us. So I would just be a big advocate and happy to help and support anybody on their journey.
I think it's me now, is it?
Yes, do please come in.
So brilliant, thank you. So my name is Louise. I'm from Ruabon Road Dental Practice in the now called City of Wrexham. I've just thought I'd share with you the experience that we had by way of how we went about tackling the pilot scheme, to give you some idea of logistically how it worked from our side of things. So we were aware for some time that dentistry was not the most environmentally friendly of industries, and we had looked back in 2020 at evolving our sustainable development policy, and committing more to conservation and the environment, and minimising the impact that we had. And then obviously COVID hit, and we regressed significantly, because operating procedures reverted to single-use disposable PPEs, installation of huge fans, daily tumble drying of everything, single-wrapped instruments, etc. So we took a big step back, and then as we began to de-escalate in 2021, we were able policy that we'd hoped to work on. So we researched how to tackle environmental issues, because we just weren't entirely sure. It was such a mammoth task, we weren't entirely sure how to go about it. We just knew that we weren't a particularly sustainable operation. And we did look at how other dental practices were working, and they tended to measure their carbon footprint and then offset it with tree planting schemes. That really wasn't the way that we wanted to go about things. We wanted to make a significant difference within the practice to reduce energy and to become a more sustainable operation overall. So we made some changes, some obvious ones. We switched our energy supplier to a more renewable energy business that wanted to reach net zero, and made a few tweaks, but then we kind of hit a bit of a roadblock. Perfect timing came with the pilot scheme that we were fortunate enough to be able to enrol on. And that just made everything, it gave a lot more clarity to how we were going to approach everything. So once we'd enrolled, I enlisted myself as project manager of the scheme, and then just put it open to the whole practice. There's 30 of us in the practice who wanted to be involved, gave them a general overview of the scheme, and 8 of the team instantly said that, you know, it was something that they were passionate about and wanted to be involved in. Everybody was interested, but there were 8 that were kind of prepared to commit their time and dip their foot in the water, so to speak. And that was really helpful because it was all walks. It was 3 dentists, 2 dental nurses, a dental therapist, a couple of admin team. So we had that kind of encompassed all of the practice. We split ourselves into pairs, and then we had a look through the framework of the Greener Primary Care scheme to see what would work best for us. And each pair chose a task that was most relevant to either what they were currently working as, what their hobbies were, what they'd previously worked as. So, for example, one of the dentists had formerly worked as in an energy supply company, so she kind of, her pairing took the lead on that. Another, Beth, one of the dental therapists, she was very interested in exercise. She also had time within her surgery time to speak to patients already about oral care, healthcare, so it was an easy bolt-on to add on the general medical aspect as well for healthy well-being. Obviously our treatment coordinator was happy to tackle the challenge of overusing paper and trying to put everything online and find better ways of saving paper. So once we've got our pairs, we looked at the scheme and the framework, and as has already been mentioned by Celine, there's a further info tab which was really helpful because that points you in the direction of how to tackle each bullet point. It gives you lots of ideas to brainstorm. It gives you lots of resources also. So pairs went off, brainstormed, came up with kind of short, immediate and mid-term goals, and we all come together, put those ideas into practice, and relay the practice meeting, which is monthly. So we kind of have a little subgroup. We relay those to the practice meetings. Only an element of it, doesn't take a huge amount of time. Even by explaining the differences that we can make, has made everybody within the practice think before we act. Even silly things like leaving the staff room light on all day. I don't know why we did it, but we did. That they're just really, you're leaving your computers on at lunchtime. There are so many tiny changes that everyone's kind of embraced. So whilst there are some mammoth tasks on that list, there are also some little ones as well, which are no-brainers really. And then we have taken those ideas into our, we've changed our behavioural aspect really. Our habits, brought those home. One of our admin team went to the extent of a vast expenditure and bought herself a washing line. Never had one before. All of a sudden realised that washing lines are a lot cheaper than tumble dryers, as well as doing our bit for the planet. So we as mentioned, the whole team's got involved. It's not as difficult as it may initially seem, and it makes a really big difference. We're ploughing through ours now. Yeah, we do have points at which there's a lot of work on, and we're having to pause it temporarily, but you know, we've got until October, and we are confident that we're going to get to our points that we want and to make the changes that we feel that we can become a sustainable practice. So that's my experience, and I think it's Tim now who's going to speak to you from Buckley Eyecare.
Thank you ever so much. It's a real pleasure to be involved. Good afternoon, all. And I'm looking forward to echoing some of the really good points that have already been made and reinforcing this really positive message and this really positive experience. Next slide, please. So in the next 5 minutes, apart from thanking Public Health Wales team for their support and their understanding throughout it, these are the 5 things that I'd like to cover. A starting point, how it is to complete the tasks and what the impacts are, and what my sort of reflection is following. So the next slide, please. So we all have different starting points. It's probably really important to recognise and acknowledge that. We all will personally perform as contractors, and everyone in the practice will have a different opinion of how important the climate emergency is, and also how relevant it is to our work. So it's worth bearing in mind that I imagine we're all, if we're on this webinar, we're all at a similar point on that journey, in that that we are keen and we see it as relevant and as our responsibility to act, and so we're very grateful that that there are efforts being made to facilitate that. I'd previously done some work in this area, and the practice had also. Next slide, please. Just really simple work, like making a climate change declaration that was visible to the patients, and also having a environmental strategic plan that we implemented on an annual basis and reviewed between the directors and the management on every 12-month basis. Next slide, please. So firstly, actually, the functionality of this, the reward scheme, is really, really simple. I'm not a techie at all. I get very put off having to learn a new thing. But it's great. It's really straightforward, really simple. So don't be overwhelmed at seeing, right, this is yet another system and another password I need to remember to log into. It's straightforward. It's also really informative and educational. So it isn't a tick box exercise. It isn't holding your hands saying, have you done this? Tick yes, and then move on. It really is, the information leads you on and it can take you wherever you want it to go, really, as far as you want it to go and as broad. So it's very informative. It is educational. Realistically, though, it does require some time, so that we have to be realistic about that and acknowledge that good work does impact on the time constraints. Next slide, please. So the impact of the practice, again, has been really, really positive. There's been a variety of changes I see looking back to how the practice was run a year ago, even though, as I say, we had begun to consider this in the couple of years leading up to this pilot scheme. Some of the changes are big, some of the changes are really small, some of them are to do with processes of what we do day to day, and other things are bigger one-off decisions. They might be what products we stock, the procurement, the wastage, utilities, but really it's a change to the mindset that is most interesting. When I speak with my colleagues about environmental responsibilities, global social responsibilities, one of the preconceptions I think that a lot of us will face is, well, that doing this sort of thing feels like a luxury. And when you really start going through what are essentially environmental QI projects, it's really apparent how very often what is environmentally the right thing is also the right thing for the patient, and it's also the right thing financially. So please don't look at this as thinking, right, well, we could do it, but what is it going to cost the practice? You may well find that you make financial savings in some areas, but also free up capacity by streamlining and informing then other pathway service decisions more broadly. Next slide, please. Thank you. And the impact of the team, again, this point has been made. I really need to reinforce this because it's a big one. It is massively refreshing to be doing something creative and innovative, where we often follow set SOPs, set pathways, set governance, whereas here we are looking for creative ideas and solutions. So that's really refreshing. It's lovely not to be talking about COVID. So embrace it, if only for that. It is super equalizing. It is really inclusive because ideas need to come from everywhere, and everybody in your practice will have their own perspective of your practice. So we'll be able to equally input, and it is a step away from the traditional clinical hierarchy that we perhaps are accustomed to. And next slide, please. So yeah, as I've sort of alluded to, really, this is not an optional extra. If you are approaching this thinking that you could be environmental for an hour on a Thursday and then not the rest of the time, it just doesn't pan out that way. Environmental aspects and behaviours become integral into every decision you make, whether it is in procurement or wastage or management, or whether it is patient decisions. You know, if there's an optician, it's part of the decision whether a patient buys a new frame or reglazes their old frame. And you know, it integrates all the decisions in a clinical as well as a practical running of the practice. So the next slide, please. So I think this is my final slide, really. My hope after doing this is realizing that it is viable. It is possible to integrate this alongside clinical and as part of clinical delivery. So I hope it really evolves. I hope we look back on this in 10 years' time and can't believe the conversations we're having, because it's moved on so much. Of course, to do that, we need this culture change. We need the support of education and time, and we need to recognise every aspect of where it needs support. But it feels like that support is there, and it's been a really positive experience to be part of. So I'm going to hand over now to the Evans Pharmacy presentation. Thank you all.
That's lovely. Thank you, Tim. So I'm going to be brief, which won't give Andrew Evans justice in the work that he's done, but I just want to make sure we catch up on time. So unfortunately, Andy Evans isn't able to make today because I think he's away sunning himself somewhere, but he has agreed and sent in some information so I can talk on his behalf. It would be remiss to not include pharmacy when we've heard from all the other contractors. So Andy Evans was one of our pilot sites. Andy owns a independent pharmacy in Newport. It's located very close to 2 large surgeries and also close to the Royal Gwent Hospital. Next slide, please. So one of the actions that Andy chose was the innovation idea action, and what he particularly wanted to do was to look at the inhaler prescribing from some of the practices that he was dispensing for. So in summary, what he did is he identified patients who were coming to his pharmacy on a regular basis to collect prescriptions for inhalers. He provided a 10-minute appointment with himself. During that appointment, he went through the inhalers that they were using, their technique. He discussed with them options to change to a greener type of inhaler and demoed that inhaler. And whilst he had their attention, he also talked to them about some broader public health issues such as their vaccination status and things like that. So he really took that opportunity, and smoking and a number of other issues, some of which are included in the framework, I hasten to add. Andy then filled in a form. He had agreement with the respiratory nurse in one particular practice because this was a small pilot over a short period of time, and the results speak for themselves. So, quite a lot of patients who were eligible had made those changes. I think in the information Andy sent me, it was only one who actually said that they wouldn't want to. Some of the others didn't change because of inhaler technique. And he calculated how much carbon was saved just in the small piece of work over a small piece of time that he had done. Next slide, please. We were fortunate to have chosen Andy, which we didn't know about at the time, because as a bit of a climate activist and champion, he'd already done quite a bit of work, and I thought it was useful to share this today because these are examples of the things that he achieved in his independent practice in one area in Newport. So he's installed solar panels, he's dug up the pavements. I think there was something in the chat around outside space and how do we do that. He's changed his electricity supplier, he's looked at his loft lagging, and quite recently he's emailed us to tell us he calculated the carbon footprint of his practice as a pharmacy. He worked out what his output's going to be, and he's invested in buying trees to offset that. So he claims to be one of the few, and there may be many more out there, carbon neutral pharmacies in Wales. We've really enjoyed working with Andy, and you'll continue to work with him over the next year and beyond. And hopefully the feeling is mutual because he's had some lovely comments in his evaluation with us. So that's all I wanted to say. We will be writing some of these up as case studies in the next couple of weeks and months, and be publishing some of these to help people know where to start. So that was it from pharmacy. Thank you.
Thanks, Sian. And thanks to Juliet, Louise and Tim for sharing and participating in the pilots, and for giving your time today as well to share your experiences. I also wanted to extend my thanks today to the other 8 pilot sites who provided their time and useful learning, which has helped to shape the final framework that we're launching today. So you've heard from those pilot sites some of the small and some of the big actions that practices and teams took in their both work and home environment to play their part in the environmental emergency. And to paraphrase from the Minister's message that you can watch on the Primary Care 1 website, her message to primary care contractors was that inaction is not an option. Wales is committed to building greener practice into our everyday decision making, and that's all of our responsibilities as we move forward. So I'm delighted now to hand over to Ellen Jones, who's the Director of the Royal Pharmaceutical Society in Wales, who has a national role within the Society on sustainability and is going to provide some closing reflections for us before we move briefly into our Q&A session. So Ellen, over to you.
Diolch yn fawr, Zoe, a prynawn da i chi gyd. Good afternoon, everyone. So yes, I'm Ellen Jones, Director for Wales at the Royal Pharmaceutical Society. And like many other professional bodies and royal colleges, the Royal Pharmaceutical Society has become acutely aware of the urgent need for action to address the climate and ecological crisis that we face on a global level. Working in Wales, I'm proud of the commitment of the Welsh Government, the world-leading approach that the Future Generations Act and Commissioner brings to driving forward positive change, and the innovation that we see instigated by practitioners across Wales. And it's been great to hear this afternoon from some of those practitioners. We have been delighted to contribute to the development of the Greener Primary Care Wales Framework and Award Scheme, and would like to thank Angharad, Sian and the team at Public Health Wales for progressing this work so quickly with such collaboration and enthusiasm. When we first met with Sian and Angharad to discuss our sustainability work at the RPS, and how we'd been thinking about developing an approach for pharmacy teams to improve how environmentally friendly their practice was, we were absolutely delighted that there was already a plan in motion that we could contribute to, that brought together all the primary care contractors into a common approach for this work. That alignment of professions is so encouraging and enables collaboration at both national and local levels. I'd just like to reflect on some of the points that Natalie shared on behalf of Welsh Government at the beginning of the session, and to reiterate why there's such an urgency around this work. So if things don't change, by 2045, the UK is expected to run out of sufficient drinking water, with heat waves becoming the norm. By 2050, if we don't buck the trends, it's predicted that 10% of our hospitals in the UK will be underwater. It's said that we'll be faced with a humanitarian crisis that will make the COVID-19 pandemic appear small in comparison. We acknowledge that healthcare delivery is a contributing factor to climate change, and medicines and pharmaceuticals are known to contribute around 23% of the NHS Wales carbon emissions. That's why we at RPS Wales fully support the Welsh Government's ambitions for the public sector, including the NHS, to achieve net zero by 2030. If we are going to achieve this target in 8 years' time, we will need to work together. The Greener Primary Care Wales framework will instigate further action for us all. At the RPS, we are committed to supporting the implementation of the framework and award scheme, and look forward to continue to collaborate with colleagues across the professions and through Public Health Wales to play our part in combating the harmful effects of climate change, to safeguard the health and well-being of the population in Wales, our future generation and that of the planet. Diolch yn fawr i chi gyd.
Thanks, Ellen. Some really sobering statistics there in terms of driving motivation to take action. So I'm conscious as we're coming to the closing 5 minutes of our session today, there's been a number of questions that have come up in the chat as we've gone along, but there's two questions I just want to highlight today. So Celine, a question for you from Alison Davis. Can you just talk a little bit more about the student audits, please?
Yes, so I'll keep it brief. You'll hear a lot more about it if you actually take part, so don't worry. But essentially, we train up students for ANEMA approved training in the morning. They have a morning of training. They look through everything you uploaded. So, for example, the comments you upload, the evidence you upload. Then they meet you for 1 hour audit in the afternoon. So that all happens within one day on the 16th of November in this case for you. So generally, it's quite an open sort of, I say more of like a friendly interview. So the students basically get to see what you're doing. A lot of them don't actually realise what's happening behind the scenes. They find it really interesting to hear what the local sort of healthcare providers are doing. So definitely a really nice experience. And the students also get lots of CV and sort of extra workplace experience from it as well. But that's a very brief summary. And obviously, if you have specific questions about it closer to the time, we'll definitely take you through it.
Thanks, Celine. And what we can do is put together a very short crib sheet to put up onto the website if people have got any further questions, and continue to pick up any questions as we move forward. And Sian, a question to you, please, from Gareth Thomas. Gareth was asking if there's any funding available to apply to become more greener. And I know we've had some examples picked up and a little bit of information in the chat, but if you could just address that one for me, please.
Certainly. So I'm going to take this in two directions. Number one, at the moment, Gareth, for general practices only, there are improvement grants, and we have been having conversations with Welsh Government of how we can change the regulations so that they can be used for environmental sustainability improvements. It's not there yet. There is a commitment from the Primary Care Division that these will be looked at with a suite of changes that are due at some time over the summer, at the end of the summer. So hopefully that will land, which will give you an opportunity to access funding. At the moment, that is only for general practices. We're also having conversations with the climate change team around future funding for primary care, because at the moment that's being channeled through the hospitals. So there's lots of opportunities for the future. The other thing I wanted to just share is, and Tim picked up on this, some of the actions that will be cost neutral, some of them don't cost at all, and some of them will be cost saving. So, you know, we're not being naive. We know some of it will be upfront costs, but it depends on what you choose. So it doesn't mean that by taking part on this, it is definitely going to cost you money. And my final comment is, what we try to do with this is link it into everything else that's going on across Wales. And many of you will be aware of the opportunities that are happening currently around the collaboratives and the cluster working and the ACD programme. And there's some opportunities through that work to think about how practices can work together on some of those actions for collective actions, economies of scale, and access some of the cluster funds or the funds that come down through that system to help support this agenda. This is something we're going to look at over the summer, and how we can nudge clusters and collaboratives into that space. Finally, we have had the privilege of looking at a number of cluster plans, and there's already a trickle of this work being embedded there. It's a bit vague at the moment, but it's started. So there's a number of opportunities other than just pure financial payments, I think, to help support this work with regard to resources. That would be my final comment. Thank you very much.
Lovely, thanks, Sian. So that's all we have time for today, but many thanks again to all of our speakers and to all of our partners and stakeholders for driving this initiative forward, and more importantly to our pilot sites for volunteering to test and help refine the framework. We would be grateful to everyone who joined the webinar today if they could complete the short evaluation. A link is in the chat and will also be sent out to you. And I also hope you'll consider joining the Public Health Network Cymru network if you're not already a member, and engage in their future events. The next session in their calendar is on Wednesday, the 15th of June, and it's a session on fair work for health, wellbeing and equity, which again is equally applicable across all of our contractor sites. So finally, if you have any further thoughts about how we can further develop, refine the greener primary care framework, or any questions or queries, please get in touch with the team. And I just want to finally say again, diolch yn fawr, and thank you again for participating today, bang on 3 o'clock. So thank you for your time, and have a lovely afternoon out in practice, and think about those green actions that you can take forward. Thanks again.